Your shoulder keeps slipping out, but every scan says everything looks fine. What if the real problem is hiding in plain sight? Welcome to SportsMed Snapshots. I'm Jana, Alfaras, a medical student at Dalhousie University, and in this short video, I'll be showing you an arthroscopic repair of a humeral avulsion of the glenohumeral ligament. To begin, a diagnostic arthroscopy is done to assess the joint and confirm the presence of a lesion. The avulsed capsule and inferior glenohumeral ligament are mobilized. The inferior glenohumeral ligament insertion site is then shaved and debrided to create a bleeding surface that helps promote healing when the ligament is reattached. A suture anchor is inserted through the subscapularis muscle into the anterior humeral head at the anatomic footprint of the ligament. Next, a traction suture is passed through the capsule while anchor sutures are passed through the inferior glenohumeral ligament to secure the tissue with appropriate tension. A second anchor is placed at the posterior humeral head to complete fixation. After this, the sutures are tied, securing the inferior glenohumeral ligament back to its anatomic footprint. On final inspection, the subscapularis muscle fibers are no longer exposed, confirming restoration of shoulder stability. Thanks for watching.